Okay, I'm going to get us started now. Hi, everyone, and happy Tuesday. Welcome to the Massachusetts Medicaid Policy Institute's webinar on MassHealth, the Basics. I'm Catherine Howitt, and I am the director of the Massachusetts Medicaid Policy Institute, also known as MMPI. MMPI is a program of the Blue Cross Blue Shield of Massachusetts Foundation. MMPI promotes the development of effective Medicaid policy solutions through research and policy analysis. We try to broaden public understanding of MassHealth and the important role that it plays in providing coverage, advancing equity, and financing healthcare services for low-income residents. Our goal for today's webinar is to give you basic background information to help you better understand the MassHealth program. We'll also try to explain how MassHealth helps advance some of Massachusetts' statewide priorities, including improving care, reducing costs, and improving health equity. So let's start by going over a few housekeeping items. So first off, we are using the mute feature on the audio line during this webinar to help reduce background noises. That said, we encourage your participation and we will be taking questions throughout the presentation. To submit a question, please click on the Q&A icon located at the bottom of the Zoom window. We will try to answer as many questions as we can along the way, and then we'll also leave time to answer more questions at the end of the webinar. This webinar is being recorded. In the next few days, you'll receive a link to the recording and a copy of the webinar slides. These will also be available on the Foundation's website. I also want to note at the outset that staff from the Foundation are available to present about the basics of MassHealth to individual organizations. So you can feel free to reach out to me if you're interested in a presentation of MassHealth, the basics for a coalition or an organization that you're part of. My contact information is available on the last slide of this deck, and it will also be posted in the chat. So with that, let's dig in. Today, I am joined by my colleague, Jesse Gottsagen. Jesse is the Senior Policy and Research Analyst at the Blue Cross Blue Shield of Massachusetts Foundation. During this webinar, Jesse and I will review many of the charts featured in the October 2023 update of MassHealth, the Basics. The chart pack was developed through a collaboration between 4Health Consulting at UMass Chan Medical School and Bob Seifert, an independent consultant, with the support of MMPI. The full chart pack is available on the Blue Cross Blue Shield of Massachusetts Foundation's website. So the main presentation today is divided into 5 sections. First, we'll start with a brief introduction to MassHealth. Second, we will dive into eligibility and enrollment in the program. Third, we will describe the various MassHealth delivery systems available to members. Fourth, we'll turn to a review of MassHealth spending and cost drivers. And last but not least, we will check in on some of the big reforms that MassHealth is implementing. And of course, we'll stop for questions after each of these sections. But we're trying something new this year. So to give us an indication of how effectively we're delivering this information to you, we are going to be asking you to answer some poll questions throughout the webinar. These questions will test your prior knowledge of some of the issues that we'll be discussing today. And then at the end of the webinar, we're going to ask you to complete these same survey questions again, just to give us a sense of the before and after and how well we've delivered this information to you. Don't worry, the responses are anonymous. So if you don't know the answer, just take your best guess. So let's get started with one of those questions now. The question should pop up on your screen. Here it is with multiple choice answers. So just please choose your answer and submit it. The question is, which of the following groups is not served by MassHealth? Is it kids? Is it seniors? Is it people living with disabilities? Is it low-income people who are enrolled in Medicare? Or is it none of the above? Does MassHealth serve all of those groups? I'm just going to give you all a few moments to answer this question. Great. Okay, so I think we're going to end the poll now. Thank you for answering it. You will see 2 more questions just like this throughout this webinar. And then we'll repeat these questions at the end of the webinar. And at that point, we'll also provide the correct answers. So now let's dig into the webinar itself. Let's start by defining MassHealth. MassHealth is Massachusetts' name for two health insurance programs combined, Medicaid and the Children's Health Insurance Program, or CHIP. Both are public health insurance programs that are jointly funded by the state and federal governments. We'll talk more about how this funding works later in the webinar. Over 2 million Massachusetts residents are covered by MassHealth, including many children, people living with disabilities, and seniors. People qualify for the program based primarily on their income. Most adults under the age of 65 can be covered if their household income is below 138% of the federal poverty level, which is a little over $20,000 for an individual or $34,000 for a family of three. Other groups, such as children, people living with disabilities, and pregnant people, have higher income cutoffs. So that's what MassHealth is. And now let's turn to the question, why is MassHealth such a critical program in the Commonwealth? There are 4 key reasons. First, MassHealth plays an essential part in the state's high rate of insurance coverage. It makes health insurance coverage possible for people who would not otherwise have it, either because their employer doesn't offer it or because they can't afford to pay for it themselves. MassHealth brings its members access to healthcare, better health outcomes, and protection from the financial burdens of medical debt. Second, MassHealth is a critical part of the state's social safety net. During economic downturns, when unemployment increases and people lose their employer-sponsored insurance, MassHealth provides the support that helps keep people covered. A good illustration of this occurred during the COVID-19 pandemic, when employment dropped significantly, but coverage rates remained high, in large part because of MassHealth. Third, MassHealth helps address health inequities by making coverage available to its diverse membership and by designing programs that target specific disparities. We'll learn more about MassHealth's recent initiatives to improve health equity later in the webinar. And fourth, MassHealth has long been an engine of innovation in the state's healthcare system. Today, MassHealth is refining new systems for delivering high-quality care, service models that address the social determinants of health, like food and housing, and approaches to paying providers in ways that reward performance rather than volume of services. So with that as our background, let's now take a closer look at who MassHealth members are. There were nearly 2.2 million MassHealth members in state fiscal year 2022. State fiscal year 2022 ran from July 2021 through June of 2022. The number of MassHealth members is even higher today, and this number is shifting faster than usual for reasons that we'll explain shortly. So who are those 2.2 million members? More than 1/3 of them are children, 55% are adults under the age of 65, 14% of MassHealth members are people with disabilities, most of them adults, and 1 in 10 are people age 65 or older. Of those older MassHealth members, 90% live in the community and 10% live in facilities such as nursing homes. And here is a slide that shows how important MassHealth is as a source of health insurance for particular groups in the Commonwealth. This really highlights MassHealth's role in promoting equity. For example, 2/3 of all people in low-income families in the Commonwealth are MassHealth members. Also, a majority of people with disabilities requiring assistance with their self-care, and 2/3 of nursing facility residents rely on MassHealth for their health insurance coverage. MassHealth also plays a critical role in covering the low-income workforce in Massachusetts. Nearly 3/4 of MassHealth members live in working families where a person working as a cashier, a fast food cook, a home health aide, or another low-paying job may not have access to employer-sponsored insurance for their family or even themselves. Or they might not be able to afford the share of the premium for the health insurance coverage that is available to them. MassHealth enables many low-income workers to stay healthy and therefore in the workforce. So now let's turn to an issue that we raised earlier, the recent changes to MassHealth's enrollment numbers. Normally, Medicaid rules require that MassHealth redetermine members' eligibility at least once a year. When the COVID pandemic started, the federal government offered increased Medicaid and CHIP funding to support states who were facing large influxes of new enrollees when unemployment spiked. But as a condition of this enhanced federal funding, states were required to provide continuous coverage to their members. In other words, most members retained their coverage throughout this period, even if they normally would have lost their coverage during the annual redetermination process. This helped keep coverage rates high as the country weathered the pandemic. As a result, over the last 3 years, we have seen a steady and rapid increase in enrollment, and the number of MassHealth members reached unprecedented levels. The continuous coverage mandate ended last April 1st, and MassHealth began redetermining eligibility for all of its 2+ million members. A serious concern with such a massive undertaking is that some members may be disenrolled from the program, even though they remain eligible. For example, this could happen if a member doesn't return required paperwork, perhaps because they didn't receive it, or they didn't open or understand the notices in the mail. To minimize the possibility of this occurring, MassHealth has adopted a comprehensive strategy to protect eligible members. The strategy includes spreading out redeterminations over 12 months, the maximum length of time that the federal government allows, increasing staff and improving systems, and renewing coverage automatically for as many members as possible, using existing data sources to verify income and other eligibility factors. In addition, MassHealth is collaborating with Healthcare for All and community-based organizations in 15 communities for targeted outreach to members with a higher risk of losing coverage through the redetermination process, including those with limited English proficiency or with unstable housing. From April through September of this year, MassHealth initiated over 1 million redeterminations, more than 40% of the 2.4 million members in the program as of April. Enrollment has fallen during that period by 3.2%, or about 76,000 members. So this slide zooms out from our current moment in time to show the trend in MassHealth enrollment over the past decade and what we might see in the next year. The left side of the chart shows the increase in enrollment that followed the eligibility expansion that was part of the Affordable Care Act. Enrollment was then stable for the next several years, even declining slightly as the economy improved. Then, beginning in 2020, we see a rapid growth associated with the pandemic, up to its peak year, when enrollment exceeded 2.4 million in June. Enrollment will decline in the next year as the redetermination process runs its course. The Healy administration estimated earlier this year that there would be a net decline in enrollment of 300,000 members through June of 2024. So let's pause here for questions about eligibility and enrollment. As a reminder, you can use the Q&A button on your screen to ask a question. It looks like we have a couple of questions that have come in so far. Okay. So someone is asking if someone can qualify for MassHealth even if they're offered employer-sponsored coverage. This is a great question, and the answer is yes. People with offers of employer-sponsored insurance can still qualify for MassHealth, assuming that they meet the other eligibility criteria for the program. That said, depending on the cost of the enrollee's share of the employer-sponsored insurance premium and some other factors, MassHealth may require that the member enroll in what's called the Premium Assistance Program. Under that program, instead of enrolling in full MassHealth coverage, the member instead enrolls in their employer-sponsored insurance, and MassHealth helps pay for the employee's share of the premium. MassHealth might also assist with other out-of-pocket costs like co-payments, deductibles, co-insurance, etc. So that having employer-sponsored insurance doesn't cost the member anymore if they than it would cost if they only had MassHealth. The general idea behind that program is it makes the employer coverage more affordable for the employee, and then it also saves money for MassHealth because MassHealth doesn't have to pay for the full coverage. Okay, I think we'll move on, and we're going to stop to take more questions at the end of the next section. But before I turn it over to my colleague, Jessie, to walk us through the material in the next section, I'm going to introduce one more of those survey questions. So remember, again, responses are anonymous, so just make your best guess if you aren't sure. But so it's up here now, I see. So this question is, what portion of MassHealth members is enrolled in a managed care plan? So just a reminder, a managed care plan also includes people who are enrolled in accountable care organizations and other forms of managed care. So are we talking nobody, a third, around a half, or 2/3 of members that are enrolled in some form of, or over 2/3, I should say, of members who are enrolled in some form of managed care? See, the answers are still coming in. So I'm going to pause and give you all a chance to record your best guess here. Okay. So we'll end the poll now. And again, we will return to this question again at the end of the webinar, and we'll review the answer at the end as well. And with that, I'll now turn it over to my colleague, Jessie Gottsagen, to discuss the services covered by MassHealth and the care delivery systems through which members receive their services.
Great. Thank you, Catherine, and good afternoon, everyone. So let's look now at the services MassHealth provides and how it provides them. Remember first that MassHealth is health insurance, in many ways similar to an employer-sponsored or commercial health insurance plan. Indeed, MassHealth covers what a typical employer-sponsored plan covers, so things like hospitalizations, physician services, including well child visits, lab tests and prescription drugs, mental health and substance use disorder treatment, vision and hearing services, and medical equipment. But MassHealth is also a public program, one that serves many people with complex healthcare needs who would not be able to receive treatment without it. MassHealth, therefore, also covers certain benefits that a commercial insurance usually does not. So these include things like more extensive behavioral health services, oral health services, transportation to medical appointments, among other services. MassHealth also covers long-term services and supports, or LTSS, for most of its members. LTSS includes facility-based care, like a nursing home stay, as well as supports provided in a member's home and community that enables them to remain there. These home and community-based services include things like personal care attendants, PCAs, adult day health, home delivered meals, employment services, assistive technology, and home and vehicle modifications. So now let's turn from here to a review of the care delivery systems through which a member receives their services. Every MassHealth member receives services through one of several delivery systems. These delivery systems are distinguished by whom they serve, how that care is organized, and how it is paid for. A primary distinction among delivery systems is managed care versus fee-for-service. In fee-for-service, the purple shaded part of this graphic on the slide, MassHealth pays providers based on the amount of services they provide. In this model, providers are not rewarded financially based on their patients' health outcomes, and no one is in charge of coordinating members' overall care across different providers. Because of these shortcomings of fee-for-service, MassHealth has gradually moved more of its members to managed care, which is organized to offer more coordinated and efficient care. As you see from this chart, over 2/3 of all MassHealth members are now part of one of the managed care delivery systems. Most members who are under the age of 65 and who don't have another source of insurance coverage are required to enroll in one of 3 managed care options, and those are highlighted in green on this chart. The 3 options are an accountable care organization, or ACO, a managed care organization, or MCO, or the primary care clinician program, which is noted here as the PCC plan. Most of these members under the age of 65 are enrolled in an ACO. The 2 types of ACOs are the accountable care partnership plan and the primary care ACO. And we'll actually go into a bit more detail on each of those ACOs in a moment. So some members with disabilities or who are over age 65 are enrolled in managed care programs designed to meet their particular needs. These options, which are highlighted in the yellow-orange sections of this chart, are OneCare, Senior Care Options, or SCO, and the Program of All-Inclusive Care for the Elderly, known as PACE. Individuals in these programs may be enrolled in both MassHealth and Medicare and are referred to as dual eligible. We'll actually discuss some special considerations for dual eligible members on a later slide. So while some dual eligible members are enrolled in a managed care option, as we just discussed, most remain in fee-for-service. And again, the fee-for-service bucket is highlighted in purple on this chart. Other members in fee-for-service include those with employer-sponsored insurance, for which MassHealth helps to pay the premium through a program called Premium Assistance, which I know we just heard Catherine reference in the last question. Let's now dig in a bit more into the managed care options with the highest enrollment among MassHealth members, ACOs. Remember, as was shown on the last slide, half of MassHealth members are enrolled in an ACO. So what is an ACO? ACOs are organized groups of doctors, hospitals, and other healthcare providers that are held accountable for their members' health and healthcare costs. MassHealth offers two types of ACOs. The first type is the Accountable Care Partnership Plan. As the name implies, these plans are a partnership of provider groups and health plans that contract with MassHealth and are paid a set amount per member per month, regardless of how many services their members use. This creates an incentive for the ACO to control costs, since they are at risk if the cost of their members' care exceeds that set monthly amount. The other ACO type is primary care ACOs. Now, these are provider-run and do not partner with a health plan. These plans pay their members' primary care providers a set monthly amount, creating similar incentives as in the partnership plans. For non-primary care services, such as specialty services, MassHealth pays providers directly for each service. So for payments for these services, MassHealth sets a spending target for the ACO in its contract. The ACO then shares in the savings or losses based on how their actual costs compare to the spending target. In addition to these financial incentives to control costs, which are built into the payment methods, both ACOs also have payment incentives to increase the quality of care their members receive. There are currently 15 partnership plans and 2 primary care ACOs within MassHealth. Some members enrolled in ACOs and MCOs also have access to special enhanced services. For example, certain members with complex needs have access to community partners to help coordinate their care. Behavioral health community partners are community-based organizations who work with members who have serious mental illness and addiction. Behavioral health community partners conduct outreach and engagement, person-centered treatment planning, service coordination, health and wellness coaching, and also facilitate access to social and community-based supports. The other type of community partner, long-term service and supports community partners, perform similar tasks for adults and children with physical and developmental disabilities and brain injuries. There are currently 12 behavioral health CPs and 8 LTSS CPs across the state. Another innovation available to a small number of ACO members is the Flexible Services Program. The Flexible Service Program provides certain members with nutrition and housing supports. And this is really in recognition that members' health and healthcare costs are strongly influenced by health-related social needs. MassHealth requires every ACO to offer at least 1 nutrition program and 1 housing program. ACOs can set their own eligibility criteria for flexible services, but eligible members must demonstrate at least 1 health need and 1 risk factor to qualify for the program. So a health need is one that calls for a significant level of attention, such as a high behavioral health need or a persistent and disabling physical condition, among others. The 2 types of qualifying risk factors are either unstable housing or food insecurity. ACOs are required to provide flexible supports to at least 1% of their enrollees, including to children, and this is in rough proportion to the ACO's overall membership makeup. Now, let's take a deeper look at the managed care options for the 1 in 5 MassHealth members who are also enrolled in Medicare, either because they are over age 65 or because they qualify because of a disability. These members typically carry 2 insurance cards and must navigate 2 distinct enrollment processes, different provider networks, and different sets of covered services. This, as we know, can cause some confusion, suboptimal care, and poor health outcomes for these members. As we saw on an earlier slide, Massachusetts has 3 managed care options that aim to align Medicare and Medicaid benefits in one delivery system and coordinate these services for dually eligible individuals. So here's a bit more information on each of those 3 options. The first option is Senior Care Options, or SCO, and this is a managed care program for people aged 65 and older. A SCO plan offers services covered by both Medicare and Medicaid, including LTSS and dental care. The second is OneCare. OneCare is analogous to SCO, but for members below age 65 who have a disability. Lastly, there's PACE, the program of all-inclusive care for the elderly. This program actually enrolls members as young as 55 who have a clinical need. The program offers comprehensive services, many delivered at PACE centers, which are sites that offer adult daycare services, a clinic, health clinic, physical and occupational therapy, and common rooms for social and recreational activities. So as was mentioned earlier, fewer than 1/3 of MassHealth members who are also eligible for Medicare choose to enroll in one of these 3 programs. The rest of the people in this group remain in the fee-for-service system. So at this time, before we move on to the next section, I'm going to pause and take 1 or 2 questions here about the delivery system or anything that has come up so far for you in this webinar. As a reminder, you can use the Q&A button located at the bottom of your screen to submit a question. So let's see, we've gotten some great questions so far. One I'm going to touch on now is a question about why a much smaller portion of people over age 65 are in a managed care delivery system compared to the portion of people under age 65. So one reason for this, and again, we're talking about the portion of people over age 65 in a MassHealth managed care delivery system compared to the much larger portion of people under 65 in a managed care system. So one big reason for this difference is, with few exceptions, MassHealth requires members under age 65 to be in one of the 3 managed care programs. Again, that's either an ACO, an MCO, or the PCC plan. On the other hand, SCO and PACE are options for people age 65 and over, or 55 and over for PACE. These members are free to remain in the fee-for-service part of MassHealth instead of enrolling in one of these managed care options. Enrollment has grown in these 2 programs over the last several years, but they still lag in terms of enrollment numbers compared to the managed care programs for non-elderly, non-duals, the under 65 population. So I think actually at this time, I'm going to pause and we will save more questions for the end of the webinar, so please keep sending them. Before I turn it over to Catherine, I'm just going to review what we've talked through so far. So far we've looked at eligibility and enrollment, the services MassHealth provides, and how those services are delivered. I'm now going to turn back to Catherine, who will talk more about program spending. But first, let's complete our 3rd survey question. I'm just going to pull that up for everyone. Okay. So this question should now be on your screen. And the question asks, what portion of the state budget does spending for MassHealth represent after accounting for the federal revenues the program generates? Is it less than half, or more than half? Again, please select and submit your answer. And if you don't know, please just make your best guess. And then at the end of the webinar, we'll review the answers to all of these questions. Okay. So I'm just going to give it another second to get a few more responses. And again, we'll share the answers at the end of the webinar. Thank you for participating in our poll. Okay. So now I will turn things back over to Catherine, who will talk more about MassHealth spending.
Great. Thank you so much, Jessie. Okay. So when it comes to MassHealth financing, the first thing to know is that Massachusetts does not fund MassHealth on its own. The federal government is a financial partner. Most of the Medicaid portion of MassHealth expenditures for services are typically reimbursed at a federal matching rate of 50%. This means that for every dollar of MassHealth spending, the federal government typically reimburses the state for 50 cents. The CHIP portion of MassHealth expenditures typically receives a 65% federal match, meaning for every dollar of CHIP spending in Massachusetts, the federal government typically reimburses the state 65 cents. I say typically because matching rates were temporarily increased from these levels during the pandemic to provide more federal assistance as states saw their enrollments rapidly rise. The enhanced rates are being phased out through the end of this calendar year. And for the population that became eligible as a result of the Affordable Care Act Medicaid expansions, the federal government contributes 90% of the program spending. Okay, so now you might be asking yourself, as we just asked you in a poll question, what percent of the state budget is spent on MassHealth? And the answer to this question actually requires some explanation. So MassHealth spending, it is a big budget item, but it's not as large a component of the state budget as it may first appear. This is because MassHealth spending generates billions of dollars in federal revenue through the reimbursements we reviewed on the last slide. These federal revenues are very substantial. So to give you a sense of their magnitude relative to the total state budget, in state fiscal year 2022, 1/4 of the state's $54 billion total budget, so the total budget it's spent on everything beyond just MassHealth, 1/4 of that budget was funded by federal revenues. And the vast majority of that federal revenue, 89%, was generated by MassHealth spending. Much more MassHealth spending is offset by federal revenues than any other item in the budget. So to understand the true impact of MassHealth on the state budget, it helps to look just at state spending that is not financed with federal revenues. In state fiscal year 2022, MassHealth represented about 22% of the state spending that is not financed with federal revenues, so just over a fifth. So with that as context, let's now look at MassHealth spending trends. In current dollar terms, MassHealth spending nearly doubled in the decade from 2013 to 2022, increasing from $10.8 billion to $19.9 billion. But if you remove the effect of medical cost inflation, the average annual increase in spending over the decade was less than 4.5%. So you can see on the right side of the chart the accelerated spending associated with the COVID-19 pandemic from 2020 to 2022 as enrollment grew rapidly. But what you cannot see on this chart is that this increase in spending was offset by enhanced federal match during the public health emergency, which reduced the impact of this increased spending on the state budget. We can also look at the spending trend in terms of its components. So total spending, which is represented in gray on this graph, is driven by two primary factors. First, the number of enrollees in the program, which is represented in purple on this graph. And second, the average amount spent on each enrollee, which is represented in green on this graph. The chart shows clearly that enrollment was driving total MassHealth spending increases in the pandemic years of 2020 to 2022, while per member spending during that time was relatively flat. While overall per member spending is a useful concept for analyzing spending drivers, that number really masks a great deal of variation in per member spending across different populations enrolled in MassHealth. So for example, people with disabilities in yellow on this chart and adults over the age of 65 in orange on this chart tend to have greater healthcare needs than other MassHealth members. These two categories of members account for more than half of MassHealth spending, though they represent only about 1/4 of all MassHealth members. Many of the services people in these groups receive are the ones we talked about earlier, which are not typically available through other types of insurance coverage like employer-sponsored insurance. One of the most important and most expensive of these services is long-term services and supports, which I know Jesse spoke about earlier. One thing to note about this chart is that this relationship between enrollment and spending that's shown in the chart, where adults over 65 and people with disabilities represent a smaller portion of total enrollment, but a greater proportion of total spending, that relationship is not unique to Massachusetts. This is a really typical pattern that's seen in Medicaid programs across the country. So the trend towards accountable, integrated, and coordinated care means that an increasing share of MassHealth payments are made to health plans in the form of capitation payments, rather than as individual payments for each service a member receives. Capitation payments are monthly payments MassHealth makes to a managed care entity, such as an accountable care organization. The capitation payment is a set fee per member per month that does not depend on the services a member uses in that month. So the capitation payment doesn't change if members receive a great deal of care that month or if they receive no care at all that month. The managed care plans are then accountable for managing the healthcare of their enrollees using those capitation payments, and they are accountable for the quality of that care as well. In state fiscal year 2022, more than half of MassHealth spending was on capitation payments. And on the fee-for-service side, those are the payments that are directly made for specific care or specific services delivered. A large portion of that fee-for-service spending was for long-term services and supports. So specifically, 42% of the $8.3 billion in fee-for-service payments that you see on this chart, 42% of that was for LTSS. Most LTSS services are paid for fee-for-service, even for members enrolled in ACOs and other managed care arrangements. The exception to that is in the SCO, OneCare, and PACE programs. So in those programs, LTSS is included in the capitation rate, but those programs have a relatively low enrollment compared to other MassHealth managed care programs. So for one more perspective on spending, let's look at providers. As we mentioned earlier, MassHealth is a big source of revenue for many types of providers in the Commonwealth. Nursing facilities as a group receive more than half of their revenues from MassHealth. Community health centers and community-based LTSS providers receive nearly half of their revenues from MassHealth. And MassHealth also covers the prenatal care for more than 1/3 of all births in Massachusetts. So that wraps up the spending section of the webinar. And we'll take a couple moments to answer some more of the questions that have come through so far. And as a reminder, if you have any questions about MassHealth spending, please go ahead and put those in the Q&A. And I'll just look through here and see. Okay, so somebody's asking about how the federal contribution to MassHealth is calculated. As you'll recall, I was talking earlier about how the federal government typically reimburses the state for about 50 cents for every dollar the state spends on Medicaid expenses, and it typically reimburses for 65 cents for every dollar the state spends on Children's Health Insurance Program expenses. So those federal shares of program costs, they were determined by a formula that is largely driven by each state's per capita income. So lower income states get larger federal shares. And since Massachusetts is one of the higher income states, it receives the minimum level of federal financial participation, which, as I said, is 50 cents for every dollar spent on the Medicaid portion of MassHealth and 65 cents for every CHIP dollar, with some exceptions. There are, I think, 10 other states that receive this minimum level of match. And then just to give you a sense of the higher end financial participation, Mississippi receives the highest federal match rate, which is currently just over 77% for Medicaid and 84% for Children's Health Insurance Program. So then maybe I'll just take one more question before I turn it over to Jesse. Okay, so this is important. This one person typed in that they don't understand the argument that MassHealth spending is not really as large a part of the state budget as we think. So as you'll recall, you saw on one slide that MassHealth spending in state fiscal year 2022 totaled about $20 billion. But because of the federal matching, that $20 billion in spending brought in nearly $12 billion in federal funds to Massachusetts. And that reimbursement would not happen with most other types of spending. In a sense, that's a credit that we receive for the MassHealth program, and the chart that we showed sort of reflects that credit. So the overall effect is that MassHealth's share of the budget is effectively less than it would be if we looked only at the $20 billion cost, since $12 billion of that cost is in effect paid for by the federal government. Okay, so we'll answer more. These questions are great. Please keep them coming. We'll answer more, but I want to take a moment to just set us up for the next section. So we've talked about eligibility, enrollment, delivery, and spending, and these really are the basics of MassHealth. But MassHealth is also really central to Massachusetts' history and reputation as a healthcare system innovator. So MassHealth-driven reforms should really rightfully be considered basic to the program as well. Which is why in this last segment of the webinar, Jesse's going to walk us through some of the significant recent reforms in the program.
Great. Thank you, Catherine. So before we dive into a summary of some of MassHealth's recent reforms, it's important to first really understand waivers. Massachusetts administers most of MassHealth through waivers. A waiver is essentially permission from the federal government to deviate from Medicaid rules to test program innovations or to gain more program flexibility to benefit members. The waiver that affects most MassHealth members is the 1115 demonstration waiver, named for the section of the federal Medicaid law that authorizes this type of federal waiver. The Massachusetts waiver first took effect in 1997, and for the last 25 years has been used to expand coverage, support the safety net, and provide incentives for delivery system innovations. So the latest iteration of the demonstration waiver began October 1st, 2022, so about a year ago, and will extend to December 31st, 2027. This version of the waiver does a number of things. It seeks to improve delivery system reforms by building on the ACO program, and it has a strong emphasis on improving health equity. So some of the ways it does this, for example, it creates financial incentives for hospitals to identify and reduce health inequities. It also tackles health inequities by expanding on programs intended to address members' health-related social needs, such as housing and nutrition, that, as we know, are at the heart of many of the existing health inequities. In addition to these priorities, the new waiver updates eligibility policies to reduce the number of people who fall on and off MassHealth coverage. And it does this by doing things such as offering 24-month continuous coverage for people experiencing homelessness. The waiver also invests in primary care and behavioral health through value-based payments and workforce investments. And as it has done since 1997, so since the first waiver, the demonstration continues its support of safety net care hospitals in Massachusetts to help them provide ongoing access to care for MassHealth members. I did want to flag that MMPI recently published a report that actually summarizes the current version of the MassHealth 1115 demonstration waiver. So if you'd like to learn a bit more about the details of the current waiver, I think we just posted a link to the report in the chat. So we encourage you to take a look at that for more information on the waiver. So while 1115 waivers typically extend for 5 years, a state may propose to the federal government to amend its waiver at any time. And that's what Massachusetts did more recently, actually, on October 16th of this year. MassHealth proposed several amendments to its 1115 demonstration. These amendments are now awaiting federal approval. The proposed amendments build on the themes of the current demonstration that we just reviewed on the previous slide. Examples of what's included in the proposed amendment are a proposal to extend 12-month continuous coverage to all adults in MassHealth. So what this would mean is that once an adult is established as eligible for MassHealth, their eligibility would stay in place for 12 months, regardless of changes in circumstances that may occur during that time. Federal law actually already requires all states to implement 12-month continuous eligibility for children beginning in 2024. MassHealth also proposed to extend coverage to eligible people who are incarcerated by providing MassHealth services to them prior to their release. It's also proposing to offer temporary housing for members experiencing homelessness after they've been hospitalized, as well as up to 6 months of temporary housing for certain homeless pregnant people and families. Another important MassHealth innovation is its enhanced behavioral health benefits that help to fill gaps in the state's behavioral health infrastructure. MassHealth is a central element in the state's roadmap for behavioral health reform. And this roadmap includes a broad set of reforms to Massachusetts' outpatient behavioral health delivery system. MassHealth is taking the lead in establishing community-based behavioral health centers, or CBHCs, which is a new type of mental health and substance use disorder services provider. And MassHealth is paying for its members' care at these CBHCs. The creation of these new outpatient providers is expected to reduce the reliance on hospital, emergency, and inpatient departments for people in crisis. And the CBHCs, there are locations across Massachusetts. As you can see, they are highlighted here on this map, on this slide. MassHealth has also added coverage for expanded behavioral health provider types, such as peer supports, to its fee-for-service delivery system to improve access to behavioral health care. So with that, I'm going to bring Catherine back up so we can now open it up to more questions. So between Catherine and I, we're hoping to answer as many of your questions as we can in the remaining time we have before we conclude. So welcome back, Catherine.
Hi. Okay, let's see what questions we have coming through. Okay. So one person asked, can children apply for MassHealth even when parents don't apply or when their parents are using work coverage? So yes, the answer to that is yes. Children's access to MassHealth is not tied to where their parents get their healthcare coverage in any way. Children also typically have higher income eligibility thresholds than most adults. So where a kid gets their healthcare coverage can be independent from where their parent gets their healthcare coverage. One person just asked, the slide deck on the website mentioned that ACOs must provide flexible services to a minimum number of enrollees. What is that minimum number? So the answer is 1% of enrollees, including children, in rough proportion to overall membership. So another person asked, do we know the demographic breakdown of the 300,000 people predicted to lose MassHealth by 2024? They ask, is there a plan type like ACOs that might see the biggest loss? So I don't think we have any numbers about what is projected to occur in terms of where those, or I haven't seen numbers that show where those 300,000 people are coming from in terms of losing their coverage. But I did want to flag that the state has a website that allows you to get at some of the demographics of the people who have renewed and lost coverage so far. So I know that at a minimum, it breaks it down by age, so kids, adults, and seniors. And it may have other demographic breakdowns too. So we'll plug a link to that state dashboard into the chat to help. And then, Jesse, do you want to take, I think there's a question about how MassHealth, the waiver and housing. Do you want to take that question?
Sure. So we received a question asking about, can we explain a bit more about MassHealth's plans to pay for temporary housing for some individuals. In response to recent the recent influx of migrants in Massachusetts and the ongoing housing crisis in the state, MassHealth included in its proposed waiver amendment that was just submitted last month, a request to use MassHealth funds to pay for up to 6 months of temporary housing assistance and related supports for homeless pregnant individuals and homeless families who are determined eligible for temporary housing assistance under the Massachusetts Emergency Assistance Family Shelter Program, and who are eligible for full MassHealth benefits as well. So this would include those with lawful immigration statuses, such as Cuban, Haitian entrants, refugees, asylum seekers, and individuals granted parole into the United States for at least 1 year. So members would also be eligible to receive supportive services, things like outreach, case management, and referrals to medical, social, and education services from community-based providers that are qualified to meet the specialized needs of this population. And this is notable because if approved, and that is a big if, it would be the first time MassHealth uses its funding to pay for housing itself and not just supportive housing services. The waiver request submitted in October also includes federal funding for a new medical respite benefit. And this benefit would pay for housing following a hospitalization or emergency department visit for people who are homeless and don't need a nursing home care, but do need continued medical care.
Okay. That's great, Jessie. And I wish we had time to answer more of these amazing questions. There's so many great ones, but I think I need to move us on to wrap this up and to give us our final quiz so we can see how effectively we delivered this information to you. But before we do that, I'm going to review a few key takeaways and sort of wrap up this webinar. MassHealth enrollment, starting with enrollment, MassHealth enrollment grew sharply during the COVID pandemic to reach about 1/3 of the Massachusetts population at its peak. And as we discussed, it's expected to fall through June of 2024 in a controlled fashion as eligibility redeterminations resume. Moving on to spending, after accounting for the federal revenues the program generates, MassHealth accounts for a little over 1/5 of the state budget. The recent increase in MassHealth spending was driven primarily by the increase in enrollment during the pandemic, and this was at least partially offset by increased federal revenues. In terms of delivery systems, over 2/3 of MassHealth members are enrolled in one of the managed care delivery systems, and more than half of members are enrolled in an accountable care organization. ACOs emphasize value, the coordination of care, and the importance of addressing health-related social needs in meeting their responsibilities to members. In these regards, community partners and the Flexible Services Program are important complements to the ACO program. And finally, reforms. So recent reforms include strategies to improve health equity, including equity-related payment incentives for hospitals and addressing health-related social needs like housing and nutrition. MassHealth has also focused on expanding the range of behavioral health services so members can more easily access needed mental health and substance use disorder care. So before we go, let's see how well we did in imparting this information. Please take a few seconds to answer 3 questions that should pop up again on your screen so we can measure how your knowledge improved throughout the course of this webinar. So again, the first question is asking which of the following groups is not served by MassHealth and offers some places to respond. And then when you're done answering that, you can scroll down and you'll see question number 2, asking about what portion of MassHealth members are enrolled in a managed care delivery system. And again, this includes ACOs and MCOs and other managed care delivery systems. And then when you're done answering that one, you can scroll down to question number 3, which is asking what portion of the state budget does spending for MassHealth represent after accounting for the federal revenues the program generates. So we're going to give you a few moments to answer all of these questions. And then I promise we'll give you the answers. So it looks like the answers have started to slow. So let's give you a few more seconds and then we'll close out this poll and we'll give you the answers. Okay, let's end the poll and let's review the answers here. So the first question, which of the following groups is not served by MassHealth? And the answer, which I think almost all of you got in that last quiz, was none of the above. MassHealth serves kids, it serves seniors, it serves people living with disabilities, and it serves low-income people enrolled in Medicare. Great. So then the second question was, what portion of MassHealth members is enrolled in a managed care plan? Again, this includes ACOs, managed care organizations, and other managed care delivery systems. So the answer to that is over 2/3. So it is the vast majority of MassHealth members are enrolled in a managed care plan. And the last question, which I think was the trickiest one the first time you all answered, this is the one with the most varied answers. What portion of the state budget does spending for MassHealth represent after accounting for the federal revenues the program generates? And the answer is less than half. So it's a little over a fifth of the state budget after accounting for federal revenues. Perfect. So with that, I'm going to just wrap us up. And starting by thanking you all for joining us today and saying a big thank you to my colleague, Jessie Gottsagen. If you all have any additional questions, and I know there were a bunch that we weren't able to get to, Jessie and I have both provided our contact information on this last slide. So please feel free to email us with any additional questions. You can also find the full MassHealth The Basics chart pack on our website, and that actually has additional slides as well as additional information on the slides that we did cover. And again, a link to a recording of today's webinar and the webinar slides will be emailed to you in the next few days. And the recording and the webinar slides will also be posted on the Foundation's website. And again, if you would like staff from the Foundation to do a presentation of MassHealth The Basics at your event or for your organization, please reach out to me, Catherine, at my contact information on this slide, and we would be more than happy to arrange that. Thank you again for your time and your attention and for your interest in this important subject. And have a great day. Thanks again for joining us.